Hello friends, today we'll talk about hair transplant. So hair transplant, as we all know, is done for baldness. Baldness can be male pattern baldness or it can be female baldness. Male pattern baldness is due to some hereditary factors, genetic factors, or some medicine, some treatments. There are several causes of male baldness. Most common is the hereditary or genetic factor. So according to the type of baldness, these are divided into 7 categories: type 1 male pattern baldness, type 1 to 7, degree and severity of baldness. And for this we do hair transplant. So I'll talk in brief about hair transplant. So in hair transplant, as the name suggests, hair transplant means we have to transplant the hair. So we take hair from a donor area which is genetically predestined to be permanent. That means a fringe of hair which remains permanent even at the age of 65, 60. That fringe of hair, they don't fall because of aging, stress, heredity or any other factor. They don't fall. So from that area we take, because they are destined to be permanent. That means that DNA of this area is hair is like that they will not fall. So that's why we take hair from that area, and those hair are transplanted in the frontal area of baldness. Wherever the baldness is, either it is in the front area, central area, vertex area, wherever the baldness is, we transplant those hair to that area. There are different methods of hair transplantation. So we will discuss in another video what are the methods. But the basic thing is that we transplant hair from behind to front, and because they are predestined to be permanent, that's why these area hair, when we transplant them in front, they don't fall. And there are no as such precautions required which are to be taken lifelong. There are only initial some precautions, like you have to wear a cap for roughly around 10 days. You should not rub your head, scalp for around 10 days, and there is some crust, minute crust which can be visible for around 4 to 5 days. But these area hair, when they grow, they take some time, because we have transplant hair roots. So from root it takes some time to come out, and around 2.5 to 3 months is take for the hair to grow out, and then it takes around 9 months to 1.5 years for the results to show. As the hair will grow long, then only they will be able to cover the bald area. So this is almost 100% successful procedure. Only hair loss we can expect in some patients who are chain smoker or on some specific medications. Otherwise, this is very satisfying, gratifying procedure.